The battle rages on over healthcare. It's like going to the fair and having a choice between chocolate-covered bacon and that fried Twinkie. Which one is better for you? People out there are having to make a decision on what they think is better. It's like, do I get that chocolate-covered bacon or a smoothie? I think I'll choose that chocolate-covered bacon. That might not have been the best choice, but we're being forced to decide. Do we want these private companies providing health insurance? Or do we want the government to take over health insurance? We're afraid of the government taking over healthcare because number one, our country could end up like Canada. You go to the hospital and it takes 23 hours to see a doctor. Or number two, as taxpayers, now we're paying for this health care. So if a person gets an abortion, and I think it's wrong for people to get abortions, now I'm paying for something I don't like. With the other side, we're afraid of having these insurance companies running our health care because, number one, in Massachusetts, you're forced to have some sort of health insurance. And there's people out there that can't even afford this health insurance. And number two, healthcare companies can deny you insurance. I might have Tourette's syndrome or bipolar disorder, and since they feel it costs too much money, they won't even cover me. And number three, a person could decide he wants to juggle chainsaws, even though he has no prior experience. And if he loses 2 fingers, the one might cost him $12,000. Well, the other one will cost $60,000 to reattach. So he just reattaches the one finger for $12,000. So now, for the rest of his life, he'll have only 4 fingers. And if he wishes he still had 5 fingers, then he shouldn't have been dumb enough to try to juggle those chainsaws. Now, a third choice we're looking into is having some sort of private insurance companies that are non-profit competing with the other insurance companies. Now, if this causes competition and causes the prices to lower, great. But if it doesn't, there's going to be people that are out of work or people that don't receive insurance from their job that still won't be able to afford health care coverage.